Hospital waiting lists for routine operations and treatments in England are now at a record high. More than 2 million people are having to wait over 18 weeks to be seen, and more than 80,000 are having to wait for more than a year. The sharp rise in waiting time shows the heavy toll that the pandemic has had on the NHS. Almost all non-urgent surgery, like hip and knee replacements, was stopped in March to make more space for coronavirus patients. But there has been some positive news, with more cancer patients now starting their treatment. Our health editor, Hugh Pym, reports.
Carol is a casualty of the COVID crisis. A year ago, she went on the list for a knee replacement, but when the virus struck, she was informed it had been postponed indefinitely. Now she's been told it won't be till next year.
The pain is, when I walk, it's constant. The minute I start walking, I have quite a sharp pain in my knee.
She understands the pressures on the NHS, but says each day things get more difficult.
I just feel really frustrated. On behalf of everyone who's in the same situation, there are lots and lots of people who are all waiting and feeling the same way as I do. And we're all in a lot of pain.
The charity Versus Arthritis said the latest figures were appalling. They show that in July in England, 2.15 million people were waiting longer than the 18-week target for routine operations, the highest since records began in 2007. Of those, 83,200 had waited more than a year. 21,600 cancer patients started treatment in July, which was higher than in May. Non-urgent operations were also cancelled in Scotland, Wales and Northern Ireland as the NHS focused on coronavirus patients. Hospitals are trying to get things back on track. At Luton, they're doing routine lung function checks on patients in their cars.
Keep going all the way out to your empty.
Usually these take place inside the hospital, but the risk of airborne virus transmission indoors means that's now very difficult. So the patients simply stay in their vehicles to do the checks. A waiting list of 1,000 has now been nearly cleared.
And we've eliminated our backlog, I'm happy to say, and as a result we need this less. So going forward, I don't envisage we'll need to do this as much as we've done in the past.
And patients say they're happy with the system.
To just come in, drive in, get it done and drive home again is very good. It's efficient.
Hospital trust leaders say things are improving, but the task isn't easy.
We're working under some really difficult constraints because of COVID. So, for example, the need to constantly change cumbersome personal protection equipment, the need to, for example, create socially distanced wards and waiting rooms. This is complicated and it's difficult.
In June, we featured the story of Jock, whose hearing is impaired. He was waiting for a procedure which had been postponed in March.
Cochlear implants.
What does that mean?
It means I hear better.
Today we heard he's still waiting. Like others, his family's trying hard to get a new date. Hugh Pym, BBC News.
The latest government figures show there were 2,919 new confirmed coronavirus cases reported across the UK in the latest 24-hour period. The average number of new cases reported per day in the last week is now 2,532. The deaths of 14 people were reported. That's those who have died within 28 days of a positive COVID-19 test. It means, on average, in the past week, 12 deaths have been announced every day. It takes the total number across the UK to 41,608. France has recorded almost 10,000 new coronavirus cases in the past 24 hours, its highest ever single-day total since the start of the pandemic. The number of people in intensive care has also risen to just over 600, the highest number since the end of June, but still a long way off the peak reached in April. The French government is meeting tomorrow to consider tighter restrictions, including local lockdowns. And travellers arriving in England from mainland Portugal will have to isolate for 2 weeks from Saturday morning. Quarantine-free travel is still allowed from the Portuguese islands, the Azores and Madeira. There are also new restrictions for those travelling to England and Wales from Hungary and the island of Reunion. But people arriving from Sweden will no longer have to quarantine from the weekend. Scotland has followed England and is introducing the rule of 6 for social gatherings from Monday. But unlike England, only 2 households will be able to meet either inside or outside, and children under 12 won't be included in the restrictions. The First Minister, Nicola Sturgeon, also announced that customers in cafes and restaurants will be required to wear face masks when they're not eating or drinking. Our Scotland correspondent, Lorna Gordon, reports.
Glasgow and surrounding areas are the epicentre of the latest outbreak here. But with coronavirus cases now rising across the country, this evening people in the city are absorbing the new restrictions being brought in Scotland-wide, imposing a limit of 6 people from 2 households who are allowed to meet.
In terms of gatherings and so on, I don't think it's particularly beneficial, especially because young people are getting targeted, like myself, who are said, oh, they're kind of selfish, don't care about other people, but in reality, people just want to return back to a normal way of life.
I don't mind masks and stuff, it's a small inconvenience for me.
Children under 12 will not count towards the 6-person limit. There'll also be limited exemptions for organised sport and places of worship. The First Minister said the new restrictions would be hard for people to hear.
After 6 long, hard months, we are still asking the public to make a lot of difficult sacrifices. That is unavoidable given the nature of the challenge we face. However, I want to be clear that while we still face a battle to get and keep COVID under control, we are in a stronger position than earlier in the year.
There will also be changes to hospitality, making it mandatory for customers to wear face coverings when moving around. This restaurant owner says they'll do whatever is required to keep the business going.
It's great being reopened, so whatever restrictions come into play throughout, we will gladly comply with them all in order to keep the thing going and to keep folk safe and well and to keep the social aspect of life going.
Hundreds of thousands of people have downloaded Scotland's new COVID contact tracing app since it was launched last night. The aim now to try to reduce transmission rates and stop the number of cases accelerating. Lorna Gordon, BBC News, Glasgow.